It's a phrase that is dominating political ads and debates this election season. Pre-existing conditions.
And that's why tonight we're taking a closer look at where the candidates for U.S. Senate stand on health care and guaranteeing insurance coverage for people with those pre-existing conditions. Rose Schmidt sat down one-on-one with interviews with both candidates, and she joins us with what they had to say about this very key issue, Rose.
Well, health care issues were what Tammy Baldwin says led her into politics decades ago, while her Republican challenger, Leah Vukmir, touts her work as a nurse in understanding the health care system. In U.S. Senate races across the country, voters have made it clear that health care is a top priority. In Wisconsin, the candidates are split on the Affordable Care Act.
I want to bring health care back to the states and back to where it should be. Decisions are made between patients and their doctors. I don't want the federal government deciding my health care.
Republican Leah Vukmir has said she would cast the deciding vote to repeal the ACA, while Democrat Tammy Baldwin is a longtime supporter, but says she acknowledges there are issues with it.
It has been unfortunately, just this bitter partisan battle. Defund or repeal the Affordable Care Act or keep it. We need to actually improve the Affordable Care Act.
At the center of the debate, if the Affordable Care Act is repealed, how will the candidates guarantee coverage for people with pre-existing medical conditions? Vukmir calls it the lie of this election cycle that Republicans want to get rid of that coverage.
Before Obamacare went into place, federal law says that if you're on Medicare, Medicaid, or employer insurance, you are covered for pre-existing conditions. That means in Wisconsin, we had almost 92% of the people that were covered. The remaining 8% we took care of through a high-risk sharing pool.
Baldwin says she's fighting to keep the ACA, but will take action if it's repealed.
I would do everything that I possibly could to make sure that people with pre-existing conditions had real options, not sham options, but real options.
When asked if they favor a Medicare for all plan, Baldwin says all smart options have to be kept on the table, while Vukmir says that proposal would lead to fewer doctors, meaning a decrease in quality of care, and it's something she says she will never let happen.
All right, Rose Schmidt reporting that. Rose, thank you.